Well, good morning, everyone. Hopefully you're having a great week before Thanksgiving. And to our friends in Canada that are on, it's a big holiday here next week in the States. We are going to be talking today about functioning with high absenteeism. My name is Jim Satterfield. I'm the CEO and president of Firestorm, so I'm excited to be with you today to talk about this. And we're calling this the quiet crisis. And the reason for that is, if you think about it, and we're talking today to the education marketplaces, K through 12, colleges, universities, even child centers. If you don't have any students, if you don't have anyone there, it's going to be pretty quiet. And getting prepared for this is a little bit different than the other plans. And we're going to go into that in more detail as we move through today's slide deck. So let me move us along. We are active on social media. We'll give you an opportunity to communicate with us, and you can contact us via any one of these sites, and the hashtag for this is #CrisisCoach. As we think about all of these things, there's a disclaimer. We're like everybody else. We have attorneys, and today's presentation needs to be viewed with the oral comments, and today is not a plan. You need to look at what the requirements are in your area and what needs to be included. But we're going to give you some insights in dealing with this particular topic. About Firestorm, we're a leading crisis management and risk firm. We're America's crisis coach. And as we look at those things, we like to get involved before the crisis to be able to help to mitigate those impacts. And if there is one, our goal is to transform that into value for you. We have a variety of groups within Firestorm. You see them listed here, whether you're looking for people or intelligence solutions or planning or security solutions. Firestorm has that available, along with analytical and benchmarking, and there are a number of opportunities to see where your plans are relative to standards and best practices. So if you're planning for a disruption, and that's one of the things that we do, I think, regularly in our webinar series, is help you look at those. But there are 4 things that can occur. You could lose your people, your facility, your technology, or your reputation, or combinations of those elements. Today, we're focusing on the first one, people, as we think about communicable illness. And this is a good point to take a brief pause to say, we're using the term communicable illness because we find many times there's a prejudice against the term pandemic. People feel like it's not going to happen where they are, it's not going to be so bad, and so they tend to not take it seriously. But with flu and other things, the idea of communicable illness does have merit. And if you've had a hard time getting traction in your organization, you might consider that change. Now, we're going to be telling you a lot of information today and cover a variety of things. But the first thing I want you to keep in mind is location, location, location. Now, I'm not selling real estate today, and that's the term that realtors use a great deal in talking about where is the property located. But where are you relative to the outbreak that's going on? The closer that it is, the more activities you have to have, and we're going to show you that in just a few minutes. The other thing to remember is, of all of the crises that are here, the fear, the panic, the rumors are going to be rampant, and it is an area for you to be focusing on at each stage, and we'll take you through the stages of events here, recognizing that it's occurred. And consistent with all Firestorm planning, we're focusing on what are the decisions you need to make, what are the actions you need to take, and what are the words that you need to say. Now, it's a human resources crisis. If we're not going to have people, we're not going to be able to do our job. We're not 100% automated in each of these areas. And if you look at the impacts that as you start to go, whether it's 20% or 30 or 40%, that is a significant impact on an organization. If 40% of your staff is unavailable to teach, if you lose 40% of your students, that's going to be a problem to deal with. If it is truly a pandemic, the cycle on a pandemic is 3 waves. You have a first wave, there's a quiet period, a second wave, a quiet period, and a third, and it can last up to 18 to 24 months. If in the back of your mind, you'll think about the swine flu that came a number of years ago, it followed that same pattern. So if we think about it, the idea of all of our policies becomes a critical one. So knowing when to take action is critical to the success of any plan here. And I want you to understand these are decisions that you need to make in your school. It's not something that you're going to be able to rely completely on the federal government or your state government or your province's government. As you look at these things, these are decisions that you're going to need to focus on to go through in this process. So as we think of each of these topics, we want to start and just give you a little bit of background at the beginning. You see an animation coming up, and sometimes over an internet web meeting it's a little skewed, but the idea is you can have direct contact between yourself and another person and then become infected. You can have indirect, where they have touched something and it then gets passed over to you as you touch the same thing. By the way, everyone refers to the pandemic back in 1918, and money was one of the ways that it was transmitted in that area. Droplet transmission, if a person sneezes, there's a liquid there, you touch it, and you get it. And then finally, airborne. All transmission modes are available in a communicable illness, but it starts to give us some of the ideas of strategies that we're going to implement. And we'll go into more detail in a few minutes, but social distancing certainly becomes one of those, cleaning another, as we minimize those contacts. Signs and symptoms here, fever, cough, sore throat, vomiting, diarrhea. Anytime it's out of the ordinary, it's a different type of an environment, suddenly that's something to think about. Now, I was able to keep this picture from my kindergarten class where I was in. I don't see me in that picture. Hopefully my class looked a little bit better than that as you go through. But this is a problem that has been around. We have 3 pandemics a century on average through recorded time, and it is an event. It doesn't have to be a pandemic for it to have an impact on your organization. It could be localized to a particular area. You could have a chicken pox, whooping cough. You could have anything that would come in and affect your school and your organization. So being prepared becomes important. Now, this slide is very complicated, so I'm going to take just a minute, a little longer, to step you through it. But I want to show you that you need to be in control. We started our call today talking about location, location, location. Where are you relative to the outbreak? Now, a few years ago, the World Health Organization, that's the WHO in the left-hand side of the page, revised their pandemic levels from 1, 2, 3, and 4. And before they had they'd broken that pandemic level phase down into multiple levels, and they went away from it. So we're in an inter-pandemic period today. That means nothing is going on. If there is a problem that they observe globally, they will send out an alert, will be escalated to phase 2. They then go to phase 3 once it's a pandemic and remain at that until they're in a transition. That's coming back as it de-escalates back in it. But that's very confusing because if you think about it from a military perspective, and someone's on a ship, they can't stand at battle stations for weeks on end. So it's got to come back and be analyzed where you are relative to those particular areas. So Firestorm, in designing their plans, and we'll go through these stages in more detail with specific actions in just a minute, we break it into a pre-action stage. That's the inter-pandemic and alert. And it's the period between outbreaks, no or limited animal to human transmissions. Those would be the indicators that that's the phase in the stage that we're in. You'll notice the imminent is now the disease mutates and is transmitted human to human. That's the point at which it's going to go faster through where you are. But it's not efficient and it's not sustained. We want to be informed here. There's not a lot that you can do other than starting to prepare. You'll see the onset is when it is now moving where you are, and we break that into guarded, elevated, and severe. By the way, we use that terminology, guarded, elevated, and severe, in a great many of our plans to help you understand exactly where you are in the critical event or crisis at any point in time. So at that guarded level, it will be a low risk to normal operations, your staff and students. There's a future potential because it's started to be human-to-human transmission in America. And if you're listening today in Canada, and I know many of you are, then we're talking about Canada. At the onset elevated, then there is close personal transmission, human-to-human, in geographic proximity. Now, in the States, you might say, well, it's within my state, or it's within my city, or in Canada, it might be in your province, as you're looking at that. So it's now in an area where it's likely that your folks will be contaminated with airports and air transmission, where someone flies from one city to another. I could be in Atlanta, where I'm normally based, and I might fly to Toronto, and then, therefore, I'm bringing that into your area. But look at that third severe level. This is the one that's the most critical, and you're going to do most of your actions here, other than the preparation up to this point. And that's when it's in close geographic proximity. It might be in your city, it might be in your county, it might be in your town, it might be in the area where you're immediately done. And so what we have to have is an immediate change in our operations in order to be able to handle it. Then the post is post-recovery, and we start to resume business and teaching in those areas. So if you look at this, and this is this Firestorm Communicable Illness 6 stages, that's proprietary to Firestorm. We certainly would be glad to help you better understand it. So we've got to talk about what we're going to monitor at each stage, and now we're going to be building to give you those tools as the next element, because you've got to understand, since we've given you this geographic divider, to understand as it's getting closer and closer, the decisions are going to be modified by what you're saying and monitoring, the actions and words the same, because as it gets closer, then the urgency to deliver. Now, externally, what are you going to be monitoring? You're going to look at what the websites are doing, who the Centers for Disease Control, your government, local and national news, tracking incidents, including closes of businesses within your area. You start to look at it, and internally looking at your numbers around absenteeism, the number of students or teachers seeking attention, those confirmed having an illness. So we'll give you a little bit more, but I need you to start to think about monitoring is a role that you need to figure out now who has that responsibility in your school. So over in the left in that blue cloud, you'll see the second portion there. You must assign someone the monitoring role. And my recommendation is now is the time to start to figure that out and start to establish a baseline so that you can see the differences when they occur. Identifying triggers. So just listening doesn't tell you anything. You've got to say, how bad does it have to be to cause us to now move to an action? And we'll tell you about what those actions are in a minute. But by identifying those triggers, you're then in a position to respond, and they're indicators that decisions must now be made. And this becomes a leadership responsibility. So that person who's doing the monitoring will then be alerting up within your school. Now, we've gone through and looked at potential monitoring sources following the WHO pandemic stages, and then we have given their division here. So you're looking at who is a source of that, the Centers for Disease Control, and others, and looking at it. Foreign government declaration of activation of communicable illness or plans. If we're seeing in the news that someone else is activating their plan, that's an indicator and a trigger that this is escalating. Now let's move on to the onset that we identified as Firestorm. Whoops, looks like we moved on past that onset. Let me back us back up here. Hang on, I'm just having one more. There we go. I'll hit that one time and see if that works. There we go. So at the unguarded and the guarded level, it says it's in your country. Confirmed cases transmitted in America. Ability to sustain company or school operations remains intact. Minimal demands on employees. So you're easily at that point. Notice that when it's elevated, now it's starting to become much more serious. Absenteeism reaches 20+%. You've got confirmed cases somewhere in one of your company locations. Others are starting to be affected. If we move beyond this and to where the severe level, you'll see then we start to see airlines making changes any closures of a major airport within the country, quarantine within an area, public-private schools start to close, businesses in your area, local events start to make a difference. When the swine flu came in, it was a weekend, and we were observing things that were going on in Mexico. And we saw the following things happen. People stopped going to soccer matches and they were canceled. We saw the Catholic church services not being attended, shopping malls being closed. All of those were indicators that something was going on there as the swine flu began in Mexico and then started to move into America. Then afterwards, as you see these numbers start to decline, then if you've had no new cases, absenteeism starts to return, local schools or other businesses start returning to normal. Those would be indicators. So you know what you have to monitor. We're giving you an idea about triggers because all of these will ultimately design the strategies and actions that you're going to take. So what you're going to need to do is to think about, we should get some supplies in. Soap, a 5% bleach solution as a cleaning agent during this will go a long way to reducing the exposures from most of the illnesses that you would be faced with. Supplies, food, if you're going to have to shelter in place. If you're listening today and you're a boarding school, are you going to keep the students there? Are you going to be sending them back home to their parents? Look at significant increases that would start to occur in absenteeism. Identify methods to reduce the spread of illness. Maybe you're spreading people out, moving the seats not quite as close together. And then again, no one is doing a favor to come through when they're sick. Many times we find people come to work because they feel, well, I'm committed, I need to be here. No, if someone's ill, we want them to stay at home and not bring that illness. You've got a plan for the delivery of services. If you're reducing staff, if teachers aren't going to be available, are we combining classes? Are we going to remote learning? We'll talk about remote learning as a separate topic in a few minutes. We have got a plan for an orderly closure of activities and how we're going to maintain instruction during a period of time that could be continued. We've got to communicate what our communicable illness plan is to our staff, our school community, the families that are involved. And then we may need to get some volunteers that can come in and help in this period of time to make sure that we are dealing with all of the issues that we need to address at each step along the way. So there's a lot of things to think about as strategies and planning, and everything that we've set up to this point have been decision-oriented steps that you need to think about now when you're not in the middle of this intense buildup of activity. But let's break this down a little bit more to think about it on a couple of different levels. Business interruption insurance. Does your school have that? Is that something that you have in place? Is what's covered? If you have to close for a period of time, if you're an independent or private school, are you going to be refunding tuition? Is that covered under your insurance? What if a government mandates closure? How does that impact your school? Does it affect us from teaching days or learning requirements that we have to have for certification to maintain it? Do you have enough capital if there's a slowdown of funds to pay? Who's paying your teachers? Where is that money coming from? If the insurer doesn't provide for refunds, how will you be able to handle those things? So you've got to review all of the contracts, not only that you're having with your students and the families, but the vendors that you have coming in to work in the school. Do they have a plan, and are they prepared? Because we don't want to invite the communicable illness into the school during a time when we're trying to maintain operations. And again, looking for those out clauses that are placed in. So lots to think about at this point. What I'd like to do is to go through the stages of that we talk about in Firestorm as we go through, and we just listed here. Pre-action, that's what you're going to be doing right now. You've chosen to attend today's webinar. And so you review the triggers for escalation from one stage to the next. Those are things that you need to establish, develop a monitoring plan, And I pointed out earlier, develop a person who is responsible for monitoring. Now, since this is a communicable illness and it is likely that someone becomes ill, in this situation, you need to be 3 deep in the position who does the monitoring. So who's the primary, who's the backup, and who's the second backup in those areas. I would document your actions for each stage that you're going to do during the alert. You've got to train and educate your companies, and in this case, your school staff, and you've got to conduct periodic reviews to evaluate and revise your plan as necessary. If you do not have a separate communicable illness plan in place today, that's a gap, and you're not going to be able to have the luxury of time to just wing it or figure it out in the middle of an event as it occurs. Now, as we move from this level, our next stage, that when we talk about it, is imminent. There's a pandemic imminent phase. There's an increase in pandemic education, employee awareness, because you're seeing it. And remember, this, going back to our earlier chart, we were talking about there's now human-to-human transmission. This means, wait a minute, it's moved up. In most cases, you're going to see these events starting out to be transmission from an animal, a bird, a pig, a chicken, from that to a human. But when you can see it sustained, going human to human, this becomes that imminent area. You want to make sure you've got the adequate resources and communications. You might be thinking about, if we're going to have to go to learning at home, what do we need to have in place? Do we want to do a test to see how that's going to work on a Friday? Figuring it out, and then review the plan with the leadership team and make any adjustments as you need to. We have the luxury of time right at this point because it's not here yet. Now, once we move beyond this and it goes to that guarded stage, now we're increasing our internal surveillance. We're looking for, are we seeing fevers? Are we seeing coughing? Are we seeing students that are developing a list of those other symptoms that we pointed out on an earlier slide? Evaluate the likelihood and timing of the disease impacting the school and its operations. It's not yet immediately in your area, but it's somewhere in the US or Canada, and you're looking at this and saying, well, you know, we're on the East Coast and it's happening on the West, or vice versa. We just need to be monitoring this and see what's happening. We also might want to be identifying if it happened at around the holidays and there was a break. Do we know the students that were traveling to see family in an area that's more exposed than the area we're in? Because then there's a chance they could bring that back. So tracking and understanding those things. Increasing communications between everyone. Communicate if you're seeing things or you have questions. The CDC and the World Health Organization are there. They will provide specific guidance related to the illness that's being spread. Over the last few years, if you will remember, we had Ebola concerns here in the States and Zika. And so it's different steps in different areas and different levels. Some of those things are transmitted by insects. Zika is an example of that. And so it tended to have a higher potential impact in the southern United States area where mosquitoes content was higher. And then you've got to start to take steps now to prevent. It's not yet here, but we know it's going human to human. We know it's in our country, and it's starting to come nearer us. Now it's elevated. We've got to have, again, increasing our internal surveillance on what's going on with our people, make any additional steps necessary to mitigate the impacts in our operations, implement best practices for social distancing. Can we spread our students out? Can we change our lunch habits? How do we deal with these matters? And we have to inform people how we're going to communicate if, in fact, we need to close the school at some point. How are we going to do it? And where possible, maintain this remote learning in periods of school closure during the periods of absences. We're not closing right now, but it's coming closer and closer. I gave you the example on the guarded. It was in California, and you're in New York. Now let's assume it's starting to come into Buffalo, but you're in New York City, or vice versa. Now it's coming here. We're in an elevated stage. Let's go to severe. we've got to make the tough decisions on when we're going to close the school. It's in our town. It's in our area. It's in our city. We've got students that are sick. We have family members of those students. We have teachers and staff that are sick. We want to then maintain as much continuity as we can with remote periods during closure. And we're blessed over the last decade with internet access and classrooms that you can set up on the internet using those communications features, that you can have a class and have assignments that can be sent out via email, or having open web meetings, just like we're having a webinar today, so that your instructors can maintain that contact. Again, I would encourage you, anytime we're talking about social media and interaction between teachers and students outside of the classroom, we want those as group activities and not one-on-one. While today is not a violence orientation, we regularly called into situations where direct contact between students and teachers in many cases leads to an inappropriate relationship. So I want to keep this as a group activity and remind you of those concerns that we would have. Now, we've gone through imminent, we went through guarded, we went through elevated, we're at severe. In all likelihood, at this point in time, you have closed the school. You're communicating with parents and teachers and staff and students. You're letting them know you're working on the remote learning capabilities and response levels at this point. And hopefully you're maintaining that contact and it comes together. When we finish this area and it starts to decline, recognize that, as I said earlier, a pandemic comes in 3 waves, spread over 18 to 24 months. So we have it right now. We're going to bring people back. We'll see a second wave in 4 to 6 to 7 months. Then we'll repeat this, and then a third wave down the road. So it's now post, we've had the outbreak over, the outbreak is over, we're post that, we're returning to normal operations at our school, and we're going to have continued heightened surveillance for the next wave. This is a mistake that many people make, not recognizing that, oh, it's over and it's done and I don't have to worry about that again. No, it will be back, and we saw that with the swine flu, and we see that with others that are coming. So we've talked a lot about the school, and I'm not finished talking about that, but I want to point out that we need to be thinking about a family response plan. This is one thing that you would like to go back to that pre-action area and start doing some education. What should be put in place at homes? How are we going to respond? And how are we going to help that family if, in fact, they've had a child impacted? So planning in advance for this particular one will be very important. Now, there's some policies that I would like you to start immediately to begin planning for. You can do that right now. Here are 5 key policies, and then I'll give you some other considerations. You've got to have cleaning and hygiene procedures established. Look at the disinfectants, and again, household bleach, alcohol, kill 5% solutions in most cases will be sufficient to do that, and determining it. Now, if you've had an outbreak that's occurring, finding these products could potentially be a problem. So you might want to, very early on, when you see that imminent stage, move to buy the extra bleach, buy the extra cleaning areas that you need to have in place so that you can focus on doing it. And I would recommend at least once or twice a year to experiment with a thorough cleaning, if not the entire school, a section of the school. So the cleaning staff understands how to do that. Now, I just gave you a term, cleaning staff. Recognize you're going to be facing absenteeism in that group just as any other. So you will find that you may have to perform some of these tasks yourself. So if we move from cleaning and hygiene, next, social distancing procedures. Let's think about how we can do this and reduce that contact capability at multiple points through the process. Canceling some of the sporting events. We may not want football games or wrestling tournaments to go on at this point in time. How do we spread those desks further out? Is there a way that we can balance how these elements come together? Maybe we cancel choir or band during a period of time to make sure that we can maximize those distances between individuals. We might want to reduce travel. Travel is, and understanding travel. If you know that someone's going to an area that's contaminated or has a particular infection, before they come back into the school environment, you might want to have them check with their doctor to give you a certificate that they're not ill. We've seen situations where even checking temperature to understand would make a difference on it. But if you know those regions, we also may want to minimize if you have students involved in projects or sports where they're going to a basketball tournament somewhere else, or maybe they're competing in some academic or debate area, of minimizing those travel requirements. Distance learning, this remote learning capability is now a valid basis for all of us, and it certainly has changed over the last decade and gives you an immediate resource to be able to do. I would recommend that you test this in advance and start getting people comfortable in this area. And I wouldn't recommend that you do this every month, but at least once a quarter, once in the fall, once in the winter, and once in the spring, to take a day and say today is going to be distance learning day, and go through it so that everyone knows how to log in, they have the right materials and tools, and how those elements would come into play. You'll learn more by doing that testing than any other way. You'll find out what didn't work and how that didn't come together. And then finally, visitors procedures. In our school environment today, and we talked about potential workplace violence and threats, we want to know who's in our school at any point in time. Having a visitor process where they check in at the main office, that they're escorted as they come together on it. I would restrict any visitors during this period of time if we're looking at a communicable illness. We don't want visitors on site at that point. We don't know where they've been. We don't know the factors. And lastly, from a safety and security standpoint, we do not want anyone coming in that we do not know who they are. Now, additional policies to think about beyond the ones that we've just mentioned here. Antiviral policies. Are you going to stockpile some of these provisions? And Tamiflu is an example that was when we were dealing with the avian outbreak a number of years ago. Leave policies. Are you going to be able to pay on the same kinds of benefits? How we don't discriminate associated with it. Remember, we're all under confidentiality information, so you will not be able to tell someone else that someone else's child is sick or ill. So screening precautions, self-disclosure, vaccine. By the way, if you are listening today and you haven't had your flu vaccine this fall, you need to do that. It does prevent, it does reduce intensity, and while it may not protect against everything that can occur, it's an appropriate step that you need to have in place. Now, communications to employees, families, customers, anybody else that you can think through, you're going to see other issues are going to start to impact. If someone has a sick person at home, they're not going to be coming in to teach today. How are we going to deal with that? Or their own child care needs. Those are all elements for us to consider. And I think starting to plan those tips to talk about what's happening will make a significant difference for you now. And beginning that communications will make a difference. As we move from that and look at what to do when you reopen, cleaning and disinfecting is critical. So you need to look at what the cleaning requirements are for the environment that we looked at. Now, I will tell you, bleach, chlorine, will kill the majority of these at a 5% solution level. Given the outbreak that's coming, whatever it is, you'll see additional guidance coming out of the Centers for Disease Control and coming out of the World Health Organization as indicators of what we need to do at that point. Review the plan with all of your teachers. I would make this part of your fall program. If you've already passed that at this point in time, maybe in January, and when everyone returns after the holidays, to remind them, this is our plan, this is what we're going to do, and have that information so that everyone receives that education in advance to know. We've got to communicate to our students and parents. It's not enough just to talk to our teachers and staff. They need to know, disseminate that information. This is the type of thing you would want to put up on your website, announcing what your policy is and your procedures, and push it out through all of the channels that you have. This is an environment that everyone needs to know, and there are some cultural differences that to be considered in the needs. Excuse me, I put you on mute to avoid my sneeze. I didn't want to send out my germs through today's broadcast. So if we think about this, we now need to come back to an area we talked about a lot, and that's thinking of continuity of instruction guidelines. And we can, we've looked at and analyzed this as you look at the various elements, and you can see what these actions are. We've talked a lot about decisions, but here again are actions to think about at each one of those. I would direct your attention to the yellow area where it says the elevated onset stage. Prepare the instructional packets to take home, evaluate the need to cancel extracurricular activities or our sports, approve each of those on a case by case. What was okay last week may not be okay this week. Adjust the attendance policies. We don't want to penalize people for staying home if in fact we're in this at this level. I would cancel any scheduled field trips, and there will start to be some that will need home education before you close the school because of an illness in their family. Once it's elevated up to that severe stage, then you've got to communicate how you're going to operate. Are you extending the school year? Are you what else are you getting done? But the remote learning at least keeps you with the academics in place. And then once you come back, then you start to resume and we'll phase those activities back in. So we've talked a lot about it, but distance learning, now is the time. Set up the website. Are you using GoToMeeting? Are you using a different tool? Do people have the login information? Also check with your vendor and supplier to make sure they can handle the load, because it's one thing when we normally think about something happened to one school, but suddenly this type of event could be all schools have a problem at exactly the same time. So does the vendor that you've selected have the capability to provide all of that at one point in time? Now, we've talked about a lot of serious things, and so I at least wanted to bring it back to a level to talk about it. It doesn't come from kissing pigs. I think the picture when I saw this one back when we were dealing with the swine flu is such a great one to stand from that standpoint. But I want to emphasize the following points to you. One, who's in charge? And the answer is you are. It's not the World Health Organization. It's not the Centers for Disease Control. It's not the federal government. It's not your state government. You are for your school. You have this specific responsibility that you need to maintain. That's why we're taking the time today to talk about it. We've been very fortunate that this event has not yet occurred at a level that we need to deal with, but it is something to understand. Now, as we go on, we've talked a lot about Firestorm services. We can help you in a variety of ways to evaluate the crisis risk, helping to provide people to run programs and staffing, the security solutions that you've heard us discuss in the past. All of these types of things are available to help you as you work through the issues that are there. The intelligence we do with our First Sight program, the monitoring of emerging behaviors of concern or events and planning, and we can even help you in this area if that's an aspect that you need to consider. And then finally, the ability to benchmark and look at analytic solutions in this particular area. So what do you need to do? You can download resources from firestorm.com, briefs. There are several there that relate around communicable illness. The recording of this webinar will be posted, and so that if you want to share it with others within your organization, you can do. I would encourage you to contact us at webinars@firestorm.com. If you need to have an assessment of your plan, we even have a self-guided assessment that we can sit down and work with you through that to help you better understand where your plans are relative to standards and best practices, and we'll waive the fee for that virtual assessment. We'll also explain our Crisis Stop program, and if we're under a retained agreement with you, the first hour of crisis support provided by Firestorm is done at no charge to your school. And then finally, you want to register for the next sessions, and each month Firestorm has a webinar series of which you're listening today. Today's version was designed for schools as opposed to businesses. There will be one each month that is school-oriented and one each month that is business-oriented. Slightly different response requirements depending upon the topic and the nature between a school and a business, and it's better to keep those separate. Next month, we're going to be talking specifically about a year in review. What's happened in 2018? What should you be aware? What does that mean to your school and your students and your structure? I'd like to thank you for taking the time this year to sit in on our webinars as we have gone through a variety of topics and issues that you're faced with. If you are aware of a topic you'd like us to add into our information and share with you, just again drop us that email at webinars@firestorm.com, and we'll be glad to put that in our planning as we look at 2019 and beyond. We also publish a digital newsletter. If you do not get that, you can go on our website and register there, and it would come out every Thursday. One was released this morning, and it will be timely because it's related to what we're seeing going on. It'll also identify for you other activities that you can participate in and be a part of. So I thank you for your time. I thank you for your service that you're doing to help our children, whether you're in preschool or childhood education area, first grade, all the way through elementary school and junior high, high school, and college. It makes a difference. You're shaping our children from an academic, a moral, and an athletic environment, and a personal one to grow. A communicable illness or a pandemic is a major threat. It is not a matter of if, it is a matter of when. In today's world of transportation, I can be in one city today and another tomorrow and another the week after. It continues to move and the threat grows, and it's not going away. If you read the reports from the World Health Organization, the number of new illnesses that are continually emerging and their level of transmission is a continual growing process. It's one that we need to be prepared for, because regardless of what the cause or what we're going to call this particular illness that comes out, it's one that your students and their parents are looking to manage. Thank you again. That concludes today's webinar. It'll be posted shortly. We will try to give you a quick reference guide to what we covered today and have that out to you in the next few weeks. So have a great day, everyone. Thank you again, and until next month, Jim Satterfield, Firestorm. Goodbye.